Florence is a way for me to communicate with my patients in a really quick, easy format.
So we hope that Florence will help empower our patients.
She's a text, that's all Florence is. She's not a human being, but she is a support mechanism.
Florence is a home mobile health monitoring system. She sends texts and she receives texts. Clinicians can see the information Florence gathers on their screens. Like the famous nurse she was named after, Florence wants more people to have good health care. She wants to make life better for patients and clinicians, and she believes in being efficient. Susan McNaughton lives in a village in Perthshire. On the advice of her GP and with the help of a dietitian, she is gradually reducing her weight. Florence is becoming a very valued friend.
She texts you once a week to remind you that you're going to weigh yourself the following morning. She texts you in the morning, she asks you to give her your weight that day, and you can do it in kilos or stones and pounds if you wish. The thing with Florence is, when you're on a diet, they suggest you only weigh yourself once a week. You can become obsessive about it, especially when you see your weight going down. You could start to weigh yourself every day. But at least when you have to tell Florence your weight, you know you're doing it once a week on the same day at approximately the same time. She's that friend that you'll tell your weight to, because you, as an overweight person, I don't even tell my nearest and dearest what I weigh. It's none of their business. And I probably wouldn't have looked at the scales anyway if I wasn't doing this. So she forces me to see what weight I am. And I tell her, and I don't mind telling her.
Jacqueline Walker is the manager of the Tayside Nutrition Managed Clinical Network. She's keen to encourage more use of telehealth solutions, like Florence.
Within the new modern outpatient programme, that's very much part of what we should be doing. So it's about allowing and providing the person themselves the skills and tools to allow them to self-manage. It's also about doing things differently. So, we have traditionally had clinics, and we have people back at clinic on a routine basis. A lot of these people don't necessarily have to come back to clinic if we can do it in a different way. And that allows the clinic time to be freed up to see more urgent patients quicker. So there's a benefit there for the NHS and for the population as a whole.
Alison Marshall is a specialist dietitian working in cystic fibrosis. She uses Florence to help undernourished people gain weight.
I find it really useful just because it allows messages that I would normally be given to patients on a consultation face-to-face. It means that these messages are spread out over a period of time. They'll get little nuggets of information that will help them to adapt their eating behaviours and their habits around what food choices they're making, and then hopefully allow them to choose things that I would say would be conducive to gaining weight.
Lisa Bonthron does the opposite from Alison. She helps people lose weight.
Well, it works in two ways. So firstly, we send a motivational message just once a week though. I think any more would probably get a bit much. But we send a motivational message once a week, and there's a different message each week. I suppose the struggle can sometimes be keeping motivation levels up long term, because our programme is actually a 1.5 year long programme and motivation levels can dwindle. So we hope that Florence will help empower our patients.
It's not just what the text messages say, it's when they come.
Yes, for my patients in particular, I tend to find that I have got quite a young cohort or group of patients. A lot of them are in their early 20s, and not all of them are following a kind of what you would class as a typical day. Some of them are quite late risers, some of them are up to the small hours of the night. So I've actually adapted, and this is a good thing about Florence, that you can go in and change the times. So I found that for some of mine who I know will not be up at 7 o'clock in the morning to send in their weight for the day, I can adapt those messages and put it to later on at a time when I know that they'll then be getting up and able to send in the information that we need.
Reminders and prompts about doing your test are an important part of the package, and it's a way of staying in touch with the clinic.
Actually, some of our patients who have stopped coming to the programme are actually still sending in their weight, or if they've missed a group session, so that means they wouldn't be seen for a full month on our initial phase, or 2 months perhaps on our second phase of the programme, they are still able to monitor their own weight and send in, which over a 2-month period especially is extremely important that they're doing that.
In a city with significant levels of poverty, Jacqueline Walker believes Florence and other telehealth initiatives can help tackle health inequalities.
When you look at any healthcare system and you look at the people who attend outpatient clinics, you find that the most deprived people are the people who are less likely to come, who will not attend, or what we call DNAs, or did not attend. We find that these are very high in those most deprived areas. And the people who do attend are the most affluent. So by reducing the number of clinic appointments and allowing people to manage their care better from home, I think it will actually impact in terms of reducing the health inequalities that are very evident in the healthcare system that we have today.
Dietitians Alison and Lisa clearly like using Florence, but has Florence added to their already heavy workload?
I don't think it's extra work at all. I think when I first talked about it at our team meetings with our team, there was a bit of resistance there because they were worried about how long it would take to add their patients. But I think what they don't understand until you use it is that everything's actually set up. So once you add your patients, you don't need to do anything more with them. I do go in and have a look and see how my patients are getting on. I think it's just something that I quite like to do. However, that definitely doesn't need to be done. It takes 2 seconds to add a patient and you can manage them in about the same amount of time. I have actually not been discharging my patients from Florence because if they've had enough or if they have dropped out of our programme, they can opt out themselves. So certainly my experience, and when I've showed other clinicians in the team how to use Florence, they've been pleasantly surprised that it really doesn't take as long as they originally thought.
Florence is already in use in Lothian, Highland, Lanarkshire, the Western Isles and many other areas. The Tayside trial of Florence includes weight management, smoke-free pregnancy services, oral nutritional support, heart failure and hypertension. You can go online to find out more about Florence nationally and on Tayside.